Welcome, everyone, to the La+Jolla+Cosmetic podcast. I'm your hostess, Monique Ramsey. I have back in the studio with me today Dr. Jerry Haas. He's one of our anesthesiologists and the director of our skinny+shot program. It's called the Signature Skinny+Shot. Say that 5 times fast at La+Jolla+Cosmetic. Welcome, Dr. Haas.
Good to be here, Monique. Thank you.
So we're going to talk not about your normal day job. You're just your new day job. Your normal day job, you're providing anesthesia to our wonderful patients and helping them have a nice, calm, sleepy time while they're having their surgery. And then now this other part that you're going to head up for us is the directorship for this Signature Skinny+Shot. So tell us a little bit about your background that sort of leads you to be a great director for this group.
Well, I started out in internal medicine, so I have some, background in internal medicine. And I mean, I'm sort of embarrassed to say this, but 35 years ago, I was working in weight loss medicine while I was in the Navy. It was sort of a side job. And obviously, weight loss medicine has come a long way since that time. I mean, back in those days, it was before fen-phen. And I mean, we were giving patients pregnancy hormones to lose weight. So it was a long time ago, and things have come a long way. But this is pretty exciting what's going on now with the GLP-1 agonists.
So talking about your role within the program as the director, what are you going to be doing and where will you be meeting the patients?
So once a patient fills out a questionnaire and has lab work drawn, they've decided to go through the program, I will be interfacing with them via Zoom, and we'll have a consult via Zoom and come up with a plan for which medication. There's 2 main medications that we'll be offering and the initial dosing of those medications. So that'll be my interface. And then there'll be monthly follow-ups that will be occurring with the staff.
And let's get into sort of the science of the skinny shot. And you've probably, those of you who are listening, you've heard about it online, you've heard about it on TV or the radio, maybe your friends might have been on it. And it's sort of this idea of whether it's Wegovy or Ozempic or Zepbound, or there's a whole bunch of them. But because there's shortages, the FDA has allowed compounding pharmacies to allow these drugs to be prescribed. So tell us a little bit about sort of these skinny shots. And let's start with, I think, maybe some of the names that people know the best. Maybe the Ozempic and Wegovy, the Semaglutide, and what that is.
So Semaglutide, which is the medication that's in Ozempic and Wegovy, and then Tirzepatide is the medication that is in Mounjaro and Zepbound. They really started out as diabetes medications, and they're really work by stimulating the pancreas to secrete insulin. And what these drugs are is they're really peptides that are released by your own gut, the cells in your gut, specific cells, and they work as a feedback loop to tell your stomach that it's full and to tell your brain that you've eaten and that you don't need to eat further. So these medications are really just mimicking those peptides, and they work for Ozempic, or the semaglutide works at the GLP-1 agonist it works at that receptor, and then Mounjaro works at the GLP-1 receptor, but also the GIP receptor. So it works at 2 different receptors.
So for the lay people in the audience on those receptors, that's probably the main difference. But in what case would you say, okay, we're going to start you over here on the semaglutide versus the tirzepatide? Or in what cases might you prescribe one over the other? And is one better than the other?
Well, I think for a lot of people, semaglutide might work, and it does work. Tirzepatide was just FDA approved for weight loss late in 23. So the studies look awesome. I mean, there's more weight loss with the tirzepatide and with fewer side effects. So more weight loss, fewer side effects. It does cost slightly more, and it works at 2 different receptor sites. instead of one. So it's really up to the patient initially what they would like to try. And then from then on, it's just based on their experience. If they're tolerating whichever drug they choose, we would just stay with that. And we gently increase the dose over a period of months as they tolerate it.
So one doesn't necessarily work better for the other for everyone. It might be more for one person that might work better versus somebody else. And that's interesting. And so the dose, you said you kind of go up slowly. How does that how slow is slow or how fast is fast?
It really is just a communication between us and the patient. And if their rate of weight loss is fine, we may keep them at that dose for a few months. We may not necessarily go up every month if they're tolerating it fine. There is a balancing act with side effects. So, some of the normal side effects are burping or nausea or vomiting or diarrhea, constipation. A lot of people don't have these, but if you do have these, then that would lead us to be more judicious with your dosing, and then also what type of diet you're eating, avoiding alcohol. There's certain things that you want to do when you're on these medications so you tolerate them as well as possible.
And how long have these drugs been around?
Yeah, I mean the first GLP-1 agonist was approved for diabetes back in 2005. So, and if you think about the process that a drug has to go through to become FDA approved, I mean these medicines have been around for over 20 years. So they've been well vetted, and as time goes on and newer drugs are developed that are in the same class, they tend to be more effective and have fewer side effects. So I think people can feel confident that these drugs are well vetted and have been around for a long time.
I think they can be very life changing. There's a lot of people on our team who've tried them for different reasons. I happen to be one of them, but I have type 2 diabetes, so I was prescribed Ozempic, and it's actually kind of exciting because I've lost 45 pounds and my
Congratulations.
A1Cs come way down. And now I'm technically probably not type 2 diabetic, but I still have to watch it. But I think it also, it works differently on your brain somehow. I don't know how to explain it, but it does make you, even if you have the urge to have that late night snack or you have an urge for food that isn't really because you're hungry, you kind of can't really entertain that urge because you feel full or you might feel sort of nauseous and you're like, no, I'm okay. I don't think I want to go there. So, have you yourself used it at all?
I did use it some last year, and I'm actually getting ready to start back on it here in a few days. But I lost about 15 pounds in just using it sort of intermittently, not in a consistent way. But I know what you're talking about, that sense of you might go to a restaurant and order some food that you like and enjoy, but you'll just eat a third or a half of it, and you're just not interested in the rest of it. And it just makes it so much easier to lose weight. I mean, we really haven't had something like this before. So it's really a game changer.
Yeah, and unlike what you mentioned earlier, fen-phen, phentermine and something else, but that was like speed, I think people who took that, I remember hearing stuff in the news and people were, bad things could happen. And so, have you really heard of any major, other than obviously some of these side effects you're talking about with, being nauseous or whatever, are there any big kind of scary things that people need to be worried about with these, or are they pretty safe?
They really are pretty safe. I mean, of course, any medication we give people, uh, there is always a very, very a small amount of risk that they could have a untoward reaction. And for these medicines, there are some cautionary notes. If you have a history or a family history of thyroid cancer, a specific type, or you have a history of pancreatitis, or you have a history of renal dysfunction, then you might not be the right candidate for this class of medication. So there's always, some restrictions with every medication, but by and large, it seems like the vast majority of people are really doing well on these medications.
And then how do you see this fitting in to our everyday practice?
I think it's going to be synergistic. I think we have over the years seen that so many patients that want to have liposculpture or body contouring procedures, and maybe they need to, ideally, they would lose 30 or 40 pounds before surgery to really get that ideal result. And this is going to help them do that. And then they can have their surgery and really get to that ideal point that they really want to be at. And we all know in adulthood or middle age or whatever you want to call it, it gets really hard to lose weight. So this works, and it can help people really get weight off in a period of 3 to 6 months and get to where they want to be, and then have that surgery for excess skin or skin laxity, and at the end point would be much better.
Yeah, I think, when we were talking earlier last year about these different drugs and thinking, is that something we should be doing? And when you can't ignore the success any longer, that's when you have to be like, yeah, I think we need to do this because it is
Here we are.
something. Here we are. Well, and having patients who trust us already with their health, and it's kind of a perfect. We're going to do this in such a safe way where, you're overseeing their care. And if you have a problem, you just pick up the phone and we're going to be able to talk you through it. And you have a team rather than something online where they're shipping it from Canada or whoever, who knows where this is coming from. And I think something else that I wanted you to talk about is, where are we getting these drugs, these two medicines that people can take? What is that? Where's that coming from?
Yeah, so the companies that make these drugs cannot meet demand at all. And so these medications have been placed on the FDA shortage list, and that allows compounding pharmacies to manufacture those medications. And we have 3 different compounding pharmacies that are well vetted. They use all USP certified product. They're FDA approved facilities. The product is tested, and over 100 different plastic surgery offices are using these sites for their medication. So I think people can have a lot of confidence that it's the real thing and it's pure. And then we're going to also be there to medically follow and guide them through the process.
And I think, some people will ask, is this covered by my insurance? And, even if it were, which unless if you're somebody is diabetic, it's really hard. And me being somebody who is and getting these drugs over the last year with the shortages, even if my
Mhm.
insurance pays for it, which they are, that I can't always get it. And this is the hard part. It's
Yeah.
like, gosh, okay, I get it. I can get it, but I can't get it. They can't give it to me because they don't have any. And so one of the things that I think is really wonderful is not only is there the flexibility of the two kinds of drugs, but then there's also and what level you need to be at, and you're going to help them with that. It's not some sort of cookie cutter thing. But then, you won't run out of it because there's these compounding pharmacies and that it's not some back room down the alley. It's with mortar and pestle, mixing it up. It's a legit place. And I think that's why, sort of like you said, why now? Why here we are bringing this to our patients because, we found a really good source. We have you, Dr. Haas, to, guide our patients through. We want it to be safe, and we're doing it the level that we've done
Absolutely.
everything. And, we spent 35 years doing things the right way. And so there's no exception here. So as people start to lose weight, other things might start to crop up. And I happen to know one of them is like the skin underneath my neck is a little looser, things like that. Body skin's a little looser. Like I feel great because I can put so many different things on in my closet and it's no longer this torturous event to try on clothes or bathing suits or go shopping. But, other things start to become apparent, which is you're getting this healthier body and at a much better weight. but then the extra skin. So tell us a little bit about things that people might not expect when they lose that weight.
It depends on how much weight I think you have to lose and your age, but people's skin elasticity changes as they get older, and it can be also due to sun exposure or alcohol use. But people's skin doesn't always retract like it might when you were younger, and so then there's a variety of things that can be done either surgically or in the med spa with different procedures in the medical spa to help people with taking care of those problems. So, I mean, the nice thing about getting plugged into a weight loss program here is we're here to take care of those issues, once, if and when they occur.
Now, back to the medicine. Have you heard any stories or misconceptions? I know there's a lot in the media right now. Have you heard any misconceptions that people might have about the medicine?
I think people need to remember these drugs are very well vetted. They've been around a long time. They're, I think the media tends to focus on anything that may come out negative about a certain medication or device, whatever it might be, whether it's, I think recently there was a thing about suicidal behavior, and then that's been sort of dispelled pretty quickly. So I think really the drugs, the take home is that they're very well tolerated. And I think you have to compare that to is to if you continue being overweight and you have high blood pressure and high lipids in your bloodstream and you're developing coronary artery disease, there's a lot of known risk with that as well. And these medications really help turn that around. And I think we always look at risk and benefit, and here the benefits are great, the risks are small.
Mhm.
So I think that's how we have to look at it.
Now, in terms of people saying, well, you can take that and you'll lose weight, but you're going to gain it back. What is I mean, obviously we all have to kind of check ourselves as we go through life and we do lose weight. How do you see patients sort of helping to wean off of these medications and then, achieving some good healthy habits?
Well, I think, we all know that this is a lifelong sort of battle maintaining a healthy weight, at least for the majority of Americans. I mean, the majority of Americans are overweight and obese even. So it's a lifelong struggle. These medicines really help kickstart the weight loss, and then during that time that the weight loss is going on, there is a focus on proper diet, exercise, maintaining your lean muscle mass, staying well hydrated to help avoid side effects, and also behavioral therapies, whether it's finding ways to deal with stress. It might be meditation or yoga or different things that people can do so they can not rely on eating the wrong types of food to deal with the stresses of life. So that is a balanced approach, and there is counseling that will occur as the program is going on. And then I think, after a period of time when people do reach their ideal weight, for some period of time, there might be a period where you're just taking the medications once a month or once every other week to help keep the weight where you want it to be. And you wouldn't be on a shot every week. So those are some of the ideas and the thinking that are going on right now with these medications.
And back to, I was thinking about cost because, there's a cost to everything we do in life. These medications cost money. But I know and we'll have links in the show notes to kind of your monthly cost. And it does depend on which medication you decide to try. But what I found is that it's really funny. I love my Mexican food. I'm not going to change that, but I'll go to Don Carlos down the street and I'll get a burrito. And I swear I get three meals
Yeah.
out of one burrito. And that's just the new reality. So you could be spending a lot in, food when you're overweight, and that is going to go away. You're going to have a lot less, and when you're trading off that expense for the medicine. And I think something else you said was really good, for that people who have high blood pressure or people who are having other health concerns because of their weight or that extra inflammation. I think, I'm somebody who has a lot of inflammatory issues as well. And it really, I don't have the same amount of pain that I used to have. And I didn't know that would, you're going to lose weight and your clothes are going to fit differently, or you're not going to fit in the big clothes and you get to get new little clothes. But that, my blood pressure medication has lowered, and maybe I'll be able to stop it at some point, but it's gone way down. And just other things that, I get out more and I walk more because I feel more comfortable in my own skin. And I think those are the kinds of like extra benefits around the edges of the weight loss that you're going to have. Be healthier, but then also feel better. And you'll have these little side benefits that you weren't necessarily planning on, including 3 meals out of one burrito.
There was a recent study that just sort of a retrospective where people were saving about $250 a month on their groceries.
Wow.
So, it was significant, and you can take that off the cost of the program. So
Yeah, that's true. So the net cost is a lot less. But one thing I was going to ask you, the reason maybe that the Tirzepatide is more expensive, do you know what that might be?
Well, since the Tirzepatide works at 2 different receptors and it is more effective and it does have fewer side effects, and it's going to be even in greater demand than the Semaglutide. The Mounjaro and Zepbound for Eli Lilly is already their biggest drug of all time. And
Wow.
they're not going to be able to meet supply for years. So there's a huge demand for Tirzepatide, and the cost to us is higher as well. So I feel like our pricing is very fair, but the Tirzepatide is a little bit more expensive than the Semaglutide, but more
Sounds like
effective.
it might be worth it too. I think I want to try it. So anything else about the program that you want to talk about?
I just want people to know that it's a real medical program. We're going to check your blood work. We're going to take your history. We're going to have you weigh in and follow you, and help you manage side effects by how we change the dosing from month to month. So you're not just getting on a website and getting something in the mail, and you don't really have the supplies to deal with it. That's all going to be done for you. It's just going to be very convenient. It's going to be very safe, and we're just going to be very thorough. So looking forward to it.
It's very exciting times, I have to say. And just you've had a little experience with it. I've had my experience with it, and it's really transformative. And so I'm very excited that we're going to be bringing this to all of our patients. So if you're listening today and you have questions or you need information about our signature skinny shot, about the pricing, we're going to have introductory pricing on the website. So we'll put that link in the show notes. And then, if you're ready to get started, all it takes is a consultation. It's really easy to get going. So Anyway, check our show notes for links. And we hope you liked today's podcast, that you'll subscribe, maybe share it with a friend. Why not? Share it with a friend. So we will all see you on the next time. And thank you, Dr. Haas.
Thank you, Monique. Good to be here.
Good to be with you.
Take a screenshot of this podcast episode with your phone and show it at your consultation or appointment, or mention the promo code PODCAST to receive $25 off any service or product of $50 or more at La Jolla Cosmetic. La Jolla Cosmetic is located just off the I-5 San Diego Freeway in the Ximed building on the Scripps Memorial Hospital campus. To learn more, go to ljcsc.com or follow the team on Instagram at ljcsc. The La Jolla Cosmetic Podcast is a production of The Axis, TheAxis.io.